In today's world of wars, anterior segment surgeons often encounter a war of their own. The iris poses an unpredictable nuisance, leading a simple surgery south. It is essential to take a thorough clinical history about previous ocular or systemic conditions, keeping in mind conditions changing the iris rigidity and medications leading to floppy iris. Intraocular floppy iris syndrome can present in various ways. Progressive pupil constriction during surgery. Iris that flops as it billows during normal irrigation and aspiration in the anterior chamber. Tendency for the iris to prolapse into the phacoemulsification and side port incisions throughout surgery. Use of pharmacological agents, cohesive viscoelastics, mechanical pupil hooks, retractors and expanders can give good outcomes in spite of a misbehaving iris. The iris is unpredictable and volatile. With no systemic history or expectation of floppy iris, we may sometimes encounter its worst side.
Round 1.
It is important to understand the fluidics that can lead to iris prolapse from surgical incisions. Bernoulli's principle states that any increase in the speed of a fluid occurs simultaneously with a decrease in pressure. When applied to phaco and fluid dynamics in cataract surgery, it means that the fluid gush out of the anterior chamber causes a negative pressure in the chamber, causing the iris to prolapse out. Any sudden removal of the instruments from the eye may cause iris prolapse. Hence, irrigation should be stopped, eye softened, and then instruments withdrawn.
Round 2.
Intracameral use of mydriatics such as adrenaline and phenylephrine may help to dilate the pupil.
Round 3.
Viscous cohesive viscoelastic may help to mechanically push the iris into the anterior chamber angles, dilating the pupil. Overfilling of the chamber with viscoelastic may cause the iris to prolapse.
Round 4.
Iris hooks are a cheap and economical means to an end. Use of iris hooks should be planned prior to the capsulorhexis so as to avoid inadvertent tearing of the anterior capsule during insertion. The hooks are placed through clear corneal, single planar ports in a diamond shape. pupil ring expanders are useful to expand the pupil at any stage in the surgery. The injector helps to control the expander insertion as well as removal. The pupillary margins stay protected and chafing of the iris is avoided. Manipulation of the cataract does not affect the position of the expander.